A full guide to understanding United Healthcare's hearing aid coverage. Hearing loss can have a big effect on a person's quality of life, so it's important to be able to get the right hearing aids. If you have health insurance through United Healthcare, which is one of the largest in the US, you may be interested in how they pay hearing aids. This piece is meant to give readers useful information about how United Healthcare covers hearing aids. This will help them understand their insurance benefits and make smart decisions about their hearing health. United Healthcare and coverage for hearing aids. United Healthcare has a variety of health insurance plans, such as Medicare Advantage, Medicaid, and plans paid for by employers. Hearing aid coverage and benefits can be different based on the plan you have. Knowing the most important parts of coverage can help you figure out which hearing aids may be covered and how much they will cost. Plans for Medicare Advantage. Hearing aids may be covered by United Healthcare's Medicare Advantage plans, depending on the terms of the plan and any restrictions. Some plans may cover everything, including hearing aids, while others may give a set amount or only cover part of the cost. The coverage may also include a choice of hearing aid models from providers or manufacturers that are recommended. It's important to look over the specifics of your Medicare Advantage plan to find out how much hearing aids are covered. Most of the time, you can find this information in the summary of benefits and other important documents that United Healthcare gives you. Medicaid. Hearing aids may also be covered by United Healthcare's Medicaid plans for people who are enrolled in them. Medicaid coverage for hearing aids changes from state to state because each state has its own Medicaid program with its own rules. It's important to look at the rules for your Medicaid plan to find out if hearing aids are covered and what you need to do to qualify. Plans paid for by an employer. United Healthcare offers a variety of health insurance plans through employers. Some of these plans may cover hearing aids. Like Medicare Advantage and Medicaid plans, the details of how hearing aids are covered under employer-sponsored plans rely on how the plan is set up. It's important to read the plan papers or talk to the person in charge of benefits at your job to understand what's covered and what's not. Hearing aids and insurance, things to think about. Even though United Healthcare may pay hearing aids, it's important to think about a few things that can change coverage and costs. 1. Deductibles and coinsurance for plans. Most health insurance plans, like the ones United Healthcare offers, have fees and coinsurance. A deductible is the amount you have to pay out of pocket before your insurance policy kicks in. After you pay your deductible, you are responsible for a certain portion of the costs. If you know about these things, you can get an idea of how much you might have to pay for hearing aids. 2. Medical need and prior authorization. Some insurance plans, like those from United Healthcare, may need to approve hearing aids ahead of time. This means that you might have to check with your insurance company before buying hearing aids to make sure they are considered medically necessary. To find out if prior permission is needed, you should call United Healthcare's customer service or look at the plan documents. 3. Providers that are in the network and preferred manufacturers. A network of approved providers and manufacturers is often part of an insurance plan. Using providers and manufacturers in your insurance plan's network may help you get the most out of your benefits and pay less out of pocket. You can get information about hearing aid providers and recommended manufacturers from United Healthcare's website or by calling customer service. 4. The limits of coverage and deadlines. Some insurance plans have limits on how much they will pay for hearing aids, like yearly limits or waiting times. Learn about any time limits or limits on coverage that come with your United Healthcare plan so you know how much hearing aids are covered. Looking for insurance and help. Here are some steps to help you figure out how your United Healthcare plan covers hearing aids. Look over your plan. Carefully read the plan papers that United Healthcare gives you to find out how hearing aids are covered. Find out about things like deductibles, coinsurance, prior authorization, and recommended providers. Talk to United Healthcare. If you have questions about your hearing aid benefits or need more information, contact United Healthcare's customer service. They can tell you specifics about your plan and help you through the process of getting coverage. Work with audiologists and providers. Seek advice from audiologists or hearing aid providers who know about insurance benefits and can help you through the process. They can help you figure out what choices are covered and guide you through any paperwork or documentation that United Healthcare needs. Look into financial help. If you find that your United Healthcare plan doesn't meet all of your needs, look into other ways to get financial help. Some companies and nonprofit groups give help paying for hearing aids or discounts on them. Your audiologist or the person who sells you hearing aids can tell you more about these options.